I'm Dr Shona Sundaraj. I'm the Group Medical Director of Medibank. Part of my role is leading the Medibank Better Health Research Hub, and the other part of my role is internal health literacy and external stakeholder advocacy. I think I've taken a circuitous route to get to where I am now. I actually started my career as a physiotherapist, and after working for about 7 years as a physiotherapist, I started to study medicine. Medicine led me into general practice, which I really enjoyed working in. I was looking after patients from a really broad demographic, but quite a well and healthy demographic. They were interested in their health and well-being, and I ventured into preventative health quite a lot with my patients. At the same time, I had 2 young children, and then the COVID pandemic happened. So I began homeschooling 2 small children and decided to take a step back from running a busy practice in the middle of the city in Sydney. So that led me to working at 2 financial services companies in life insurance, TAL and Zurich, where I took on increasingly senior roles working in product and innovation, development and underwriting, and looking at the claims journey for our customers. It was a really interesting journey which led me to completing my MBA, which I did through Imperial College in London. And after that, I was chosen to work in this role now as Group Medical Director at Medibank. So it's a role where I've had a lot of challenges, and it's a career, I suppose, where it hasn't exactly taken a straight line through route, but really makes me a true generalist. And having the ability to therefore apply medical knowledge and understanding and what I would apply to a patient and their family, but to a much larger and scalable group of people. So looking after our customers and having a role in the strategic leadership of research from the business and the health literacy of our internal staff as well is a really exciting place for me to practice medicine from now, I suppose. We work at scale to look at putting research proposals in with research funding, and we partner with universities, translational research facilities and medical research institutes. So some of our peak medical bodies like ANZCA and the FRACGP and the AMA. So we've got $1 million in funding where we work with different partners to be able to look at not the basic end of science, not the academic end of science, but really what impacts and really what we can put into clinical implementation for patients and our customers. One of my favourite recent research projects that we've worked on has been the Proactive Primary Care pilot, which is where we've partnered with 3 Western Sydney MyHealth medical clinics. And in this, we've run multidisciplinary teams where we've had a social worker, a practice nurse, a pharmacist, all working together with a GP to look at how the patients are treated within the practice and whether there's any care gaps. And the Medibank Better Health Research Hub has partnered with the Australian Institute of Health Innovation at Macquarie University to evaluate this particular project. Now, this has been a $3 million spend by Medibank, with another close to $500,000 spent by the Medibank Better Health Research Hub to evaluate this particular project, which has run for 3 years. We're about to enter into the second 3 years of this, where we'll be focusing more on prevention and healthy ageing and bringing in the first 2,000 days of life. What's really exciting about this particular project is it is enabling GPs to work with a multidisciplinary team, identify where care gaps are, and it's demonstrated a really significant reduction in rehospitalisation, falls rates, better control of markers like HbA1c and other diabetic markers, increased vaccinations. And so overall, we're seeing that GPs are able to practice and provide preventative healthcare in a really measurable and sound way, which eventually, and the whole point of it, is to help their patients live healthier lives. So that's one of the projects that I'm particularly excited about at the moment. And it falls under one of our research pillars, which we call prevention in primary care, and it also sits under innovative models of care delivery. So it's a challenge and an opportunity, because we know that clinical research has been focused on the basic and academic science end for a really long time, and implementation and translational research and science is really at the other end of the spectrum. And there's a raft of possibilities which make clinical research and implementation science able to talk to each other. But unfortunately, the way that the system is structured with research and the way that the health system is structured as well is it's a continuum, but it's difficult to get from one end to the other. So one of the things that we've really focused on with the reset of the research hub at Medibank has been that we ask our researchers to think about the impact that their research piece will have. We ask them to think about the scalability of it. We ask them to think about the populations that they're performing the research with and who is leading and co-designing the research with them. And we also ask them to think about how that research might be thought about in terms of translation and implementation, because without the translation and implementation arms of the research being embedded, we get a lot of research at the basic and clinical end, but we don't really get clinical services that can be delivered therefore. So we've really got to think in terms of scale, and if something is a good project and a good proposal, then can it be lifted? Can it be elevated? If it works in this population, could it be shape-shifted, and can it work in a different population as well? Or can the care delivery be such that it's digitally enhanced or doesn't necessarily become affected by workforce shortages? So when we reset the Research Hub, we were thinking specifically about impact and implementation as being the two measures that we'd really like to see. And we've started to develop some of that information and evaluate some of that information that's coming through now into my third year of working with the Research Hub. And we're beginning to see some really good results, such things as researchers leveraging their initial research to then be able to apply for MRFF grants. We've had around about 10 of those applications that have come to us looking for support for their projects to be scaled in a greater way. We've also seen various projects where they've worked in small communities where they'd like to lift them and get them right across Australia. One of the examples of this has been a project with the Murdoch Children's Research Institute, which has been embedded across Victorian primary schools, which with the help of an MRFF grant, they're hoping to get right across Australian primary schools. So that's a horizontal look at how some implementation of a service can be lifted and elevated and given to a greater population, which in turn enables equity of access to that service and hopefully a really good result in terms of patient care, and in this case it's about children's mental health and building good mental health and resilience. One of the main trends we're seeing is prevention and healthy ageing. So a lot of people are calling this longevity. Prevention can be a somewhat stigmatising word at times when we think that people need to be prevented from developing certain diseases. So I like to consider it as being healthy ageing. And healthy ageing really starts from preconception into pregnancy and when a baby is first born. So looking at the metabolic determinants of their health from the time they're born with good food, good sleep, good amounts of movement and exercise. And that really carries them through to a state where metabolic health is paramount, and we know that people have less likely a chance of developing diseases like that of vascular diabetes, prediabetes, heart disease, if all of these factors are taken into consideration. There's a lot of people spending a lot of money at the pointy end, looking at supplements and peptides, which may not necessarily be evidence-based, but thinking really deeply about the grassroots, the social determinants of their health, and how that can be horizontally aligned into creating a world in which we can start to be very upstream and be very primary prevention focused, I think is very important. One of the goals of our research hub is to partner directly with people that are very tailored to working in women's health research. And what we know is that like kids aren't small adults, women aren't small men. And so it's a really nice thing to be able to advocate for equity in research from an industry perspective. And when I say industry perspective, we have 4.3 million customers, so it's a really nice thing to be able to partner such that we can think about how do we shift the dial in women's health, in community health, in public health, with the same lens that would be used with the NHMRC recommendations for what research should go into funding. I think the other thing that I think is really important is the acknowledgement now of women's health at different ages and stages. For a large part of the population, perimenopause and menopause, that older women might have gone through was a time when there was some misinformation in the system around the use of menopausal hormone therapy. And that information has now been corrected because we know that that particular study on which that misinformation was based has now been found to have had an incorrect criteria of people that were included within the study. So now more and more we're realising that women from the age of their late 30s up until their mid-50s are really going through a transition point of perimenopause into menopause, which is an important time because they're now what we call the sandwich generation, when they've got young children and they've got elderly parents to take care of, but they're also at the peak of their careers. So how we look after women in that age group and that demographic is very important. It's an important time to get in also because we know that we can risk reduce for cardiometabolic health, for dementia, for bone health. And so looking at women in that particular age group for me is a very important consideration. I really love the work that I do because it means that thinking as a doctor, I get to apply it to our customers and to our staff internally. It looks at health from different angles. So how do we broaden ourselves and our reach as a health company? How do we help with the health ecosystem? How do we start to embed research into what we do? And how do we evaluate our programs and our services with that evidence-based frame of mind? All of those things are really important to me. So I still think like a doctor in many ways, but I think in terms of how do we get the broadest reach? How do we support our staff in understanding what health actually means? Because we're a company that, whilst we have about 1,000 clinical staff, the other 3,500 staff might be financial or legal or, working frontline with customers. So the health literacy of our staff right across the business is very important. And when we think about how we want to change or make a stake in changing what the health environment looks like, it's an important thing, I think, to have senior clinical members within the business that are able to talk to those changes too. I like to run, and at the moment I've got an ankle injury, so that's probably not the best answer to give you. So outside of work, I'm a runner. I love to cook. I love to travel. I've got 2 wonderful children, and I've got 2 lovely dogs as well. So we all have a good time together, and we like to be outdoors a lot.